Welcome back to the future of figure skating. My name's Anna Keller, and my guest today is Dr. Ami Parekh. Ami made history as the first skater to represent India at the World Championships. After competing, she attended medical school and she now works as a physical medicine and rehabilitation doctor. She's passionate about helping skaters be healthy at all stages of their career, and she frequently works as the medical director at competitions. Ami is also the executive director of the Chicago Youth Foundation, an organization which brings figure skating and hockey to underserved communities. I was thrilled to have such a deep conversation with someone who is working in many ways to make figure skating a healthier and more inclusive place.
Dr. Parekh, thank you so much for joining me on the future of figure skating. It's great to get to speak with you. How are you doing today?
I'm doing great. Great.
Wonderful.
Thanks for asking. How are you doing?
Great. So I want to talk with you about a couple of the different roles that you're playing in different spaces related to figure skating. But first, can I ask you a little bit about sort of how you got into figure skating and your earlier time as a competitor? How did it all start for you?
So actually, I came from a family that we didn't have any athletes in our family, and the emphasis culturally on girls in my family and others in our South Asian background, which is where I come from, was there was a big emphasis on a sedentary lifestyle for girls actually, and so it's kind of surprising that I kind of became an athlete, given that background. I started out being very non-athletic. In school, I was always the last kid in all of my races. I never took interest in physical education. Um, I hated it, and I never really tried hard, and I never did well. And so then somehow I got interested in skating. I went to the rink and tried out a couple of lessons with my older sister, and then I like it was like a thing where it clicked. I liked doing it so much. And so that was kind of the beginning of my intro into the world of athletics and activity and sports. I did start late, so most kids start when they're much earlier. By the time so I started when I was 7, meaning just tried skating when I was 7. I split my chin open on my first public session. I picked it up quickly. I was skating super fast, and then I fell on my chin and had to go get stitches. So I was traumatized. I was like, I'm not doing this again. And then somehow I got back when I was 9, and then started competing when I was 9. I started in pre-preliminary, and then I kind of improved kind of quickly, I guess, and was in juvenile by 12, and then kind of everything kind of took off from there. Um, yeah, and then I obviously competed for competitively, skated for the U.S. Until novice, and then I skated. India became a new member of ISU, and they needed a representative, so I skated for India in my junior and senior years. I went to the World Championships a couple times, 4 continents a couple times, and tried out for the Olympic qualifiers. Didn't quite make it there. There was a time when I quit skating for a couple of years. This is around the time when I was 19 because I had an injury and I was pretty much done. I didn't want to be done, but I was done because I was kind of forced to, and it was an upsetting identity crisis time in my life. But I did luckily had other goals, so I was focusing on them, such as medicine. And I ended up, I didn't even go in the rink for a while. And then 3 years later, I was like, oh, I want to compete again. I was feeling better. And so then I went back as an adult. So I started competing from like age 22 until 21 to 24. So I competed. I actually was better in some ways. My jumps were better, actually. Of course, I had to relearn everything. And then I competed and I got to quit on my own terms. I've retired when I was 24, and then that's when I went to med school.
That is really, really great that you were able to have it be on your own terms. I want to ask you also about what it was like for you to be competing for India and for a new federation and getting those international opportunities.
Yeah, so I was always in my period at least. I was one of the few. In fact, I think I was the only South Asian that was at competing at the higher levels, and so something I noticed as a kid. However, I never really thought about it until you get older and you start thinking about who you are and where you came from. How come I'm different from other people? When you're teenagers, you start thinking these things, and so it was always so whenever. I always ask my mom, like, why are Indians skating? Why am I the only one? Anyway, so then, fast forward, I don't know if it affected my performance necessarily, but it definitely was something that crossed my mind all the time. And then, when I did, so then when India became a professional member, I was like, "This is so cool, like, I could skate for a country that doesn't even exist on the map in the figure skating world, and I could, get to be more in touch with my culture also, and also kind of put the 2 worlds together." It was like an opportunity to put 2 and 2 together, and I always love that. As you'll see, it's like a common theme in my whole life. Whenever I can find something that marries all of my separate interests, I grab those opportunities if possible. Um, but basically, yeah, so and then I started skating for India, and that was a whole experience being in another country, because I had to, obviously live there, and then train there, and there was, like, rinks that were very small, like,
Mm.
amusement park size, like, rinks that were the size of maybe a little bed a small bedroom, and, so I had to train on those, and they weren't necessarily clean, they were cleaned by brooms and water hoses. They didn't necessarily have Zamboni, so it was interesting to see, like, the other side of the sport because, honestly, going there and training there helped me understand the history of figure skating because back in the day, like, that's what all the other countries were doing
Right.
years ago, and so it was so nice to, like, really understand the roots of the sport and really
Mm-hmm.
understand how, like, things start and how a sport begins and how, it was, of course, sometimes frustrating because I have already seen what it's like in a country where things are all ready to go and you have ice and you have great coaches and you have equipment, and then I'm in this other country where you have absolutely nothing and everything is from scratch and you're gonna have to make do with what you have. So it's cool to get both perspectives and really, at the time was hard, but I'm glad I had that experience because it enriched my understanding and really put a lot of pieces together. And so the other part was culturally too, because, I was able to kinda get more exposure to Indian culture by living there and, understand where my family came from, and, helped me appreciate my family a lot more. And also, it helped me bring more interesting ideas to the ice as well. And so, like, I did obviously put Indian music and Indian dance, outfits on the ice, whenever I could, and, yeah, that was, very valuable too.
Yeah, I think that's really cool that you were able to bring some of the culture, especially as you were experiencing it, into the ice. It's something I talked with Tara Prasad, who's now representing India, and she trains in the US. And so I hadn't realized that you'd actually gone to and trained in India while you were doing while you were representing India. But talking to Tara, she was saying part of why it was so important for her to do some Indian um, things coming from movies and musicals that she had a connection to is because she would see so many skaters that had no connection to India doing very superficial sort of Bollywood or Indian programs, and that didn't sit right with her, and she wanted to do something in a way that was more authentically connected to her heritage. And so I was curious how you felt about that, sort of the way that Indian culture is represented in figure skating versus sort of what you were trying to bring to it as someone with that heritage.
Yeah, I'm glad you talked to Tara because she's awesome. She's like kind of the next generation, bringing India to the world stage, and she's amazing. She's great at what she does. She's super talented. I'm so glad for her successes recently. Hopefully, she can continue. But yeah, so what she says is totally true. We've seen obviously previous Western skaters bring Indian performances on the ice. I and Of course, there's a certain level of understanding and when going into it because they only have so much time to kind of study the art form before they bring it on the ice, so it's not their fault necessarily. But there is a lot more to Indian art, music, and performance than you might see. That might meet the eye of somebody who doesn't know. And there's a lot of depth, richness, and authenticity that does go along with it all. And so, I did think Meryl and Charlie did, probably one of the best jobs. They did I think, fantastic job, actually, and I think it was helpful that they had an Indian choreographer working closely with them, and they worked really hard, and delivery was not easy, but they delivered amazingly. So I think they did a good job. I think other people have tried. I thought it was a good effort on their part because honestly, it was kind of cool to see something interesting or someone trying to do Indian culture on ice. However, um, it's nice to have the real thing. And so obviously, I tried to do some of that whatever time I had, and then Tara's kind of doing that as well. And there's a subjective side to judging in figure skating, and so unfortunately, the panel of judges are not Indian. or may not have too many ties to the culture. So what happens is they might see something Indian on the ice and be like, "Oh, that's kind of cool," and we'll give a great mark because that was cool or super colorful and super fun to watch. But the nuances, the understanding of the actual art form, what the meaning is behind all of it, is missed, and so the joy of it kind of gets lost to the judging panel as well as to the audience if we don't have more South Asians on the judging panel or in the audience. So just something that would be great in the future.
Totally. I've often thought about like what kind of different like cultural and artistic and musical education the judges have. And, it's sometimes it's hard enough when you're asking them to know about, classical ballet or something that's in skating all the time, much less something that they might not be seeing all the time. But it's such an important thing for them to be able to know any of that background and that have that ability to judge not just the from the skating side but from like the aesthetics and artistic side too.
I do a lot of work for the underserved population here in the U.S. And actually, a lot of my ideas came from doing that kind of work in India. Actually, so when I was there, I obviously skated and trained, but I also like we spent our time there. I mean, we were there a lot. We would try to teach the some of the low income people there. There are many over there, and not just them, but others, and really bringing the sport to a population that didn't understand it was interesting experience because so we would teach and perform for them, and so that was kind of something I kind of got to do here through how I got involved with Chicago Youth Foundation, which I'll talk about next.
Yeah,
So that it all kind of all fits in together.
absolutely. Yeah, so tell me a little bit about the Chicago Youth Foundation.
So Chicago Youth Foundation is our mission is basically we're a women-led initiative that helps bring underserved populations, including ethnic and racial minorities and low socioeconomic status children, to get to experience ice sports, including figure skating and ice hockey, especially
Mhm.
uh, for free. Because unfortunately, we've seen like these kids either don't even know about the sports and because their cultures or their type of people don't go into it or they have this understanding that it's a rich sport, they may not
Mhm.
even be willing to even their parents may not even be willing to put their kids in it or try it out. And we're women led because um well, figure skating is pretty women led. But we're women led because we don't see a lot of women in leadership positions as executives, unfortunately, especially in the sporting world. I know we see a lot
Yeah.
in figure skating, but at almost every other sport, women are a super minority. We are outnumbered and we are paid less, and so and we also cater to ice hockey too. So you're women led for that reason, and try to give women more opportunities to be in leadership roles. And so basically, we basically give free ice and equipment
Mhm.
to and ice skating lessons to, these children, and we were traditionally at 2 rinks in the Chicagoland area, and one is in the South Side, which is where the lowest income and the most minority populations live, and then the other's at McFetridge, where we have huge Latino population, and so we're out traditionally at those 2 rinks. However, as people have started to understand, us and learn about us, and we've done a good job, We've had, the city of Chicago hire us to run the ice skating lessons on the weekends at Millennium Park, which is a famous Chicago emblem here, so that's been fun for the last 2 years, and then we've, actually, partnered with the Blackhawks recently, to help run their help with them, partner with them for their community learn to skate programs to help engage their communities there near the, Humboldt Park, which is another very poor
Mhm.
area of Chicagoland. And so, it's been great, like, it's been a great experience I'm the executive director. I
Mhm.
started out just as a medical student that wanted to coach these kids because I wanted to start something for figure skating, so I met the founder, Ray Lilja, I bumped into him, maybe even stalked him at an ice skating rink, and I was like, "Hey, I have this idea for figure skating, you think we could partner?" And it started because he already had been doing it for ice hockey,
Mhm.
and basically, this was 10 years ago, and ever since then, I started their Learn to Skate program, and then now we have a Learn to Skate program, and then they can kind of once they pass basic 6-ish, 4
Mhm.
to 6, they can pick between figure skating on your block or hockey on your block. And then as a doctor, once I became a doctor, I wanted to incorporate that in the organization. So we have like an off-ice youth development program to help educate kids about health and safety topics because these
Mhm.
kids have even like less information and less access to information, unfortunately, than other
Mhm.
families might.
Yeah. So you spoke a little bit about what some of the barriers to even being introduced to ice sports are for a lot of these kids. What have you found that's been helpful in terms of getting them introduced? And then I think one of the barriers that I often wonder about is sort of that transition from, okay, maybe you've tried, you learn a little bit about skating, but then to go from that to thinking about doing it as a sport or as a more intensive figure skating thing, there's maybe other barriers that come into that part of the process as well.
So there's a couple barriers in both the recreational level and the elite level of figure skating. And we're right now tackling the recreational level. However,
Mhm.
there's definitely other organizations trying to tackle the elite levels as well. And we hopefully in the future there's opportunities for us to partner with them and U.S. figure skating to kind of help tackle everything. But
Right.
basically the barriers at the recreational level are that like I said, minorities are not likely to, or the lower income are not likely to try ice skating because their friends and their community circles don't try ice skating. They don't watch it on TV, and they don't hear much about it. So they're not likely to try just from that standpoint. The second standpoint is if they do try it, they're more likely to be distrustful of the personnel in the sport, the coaches, the officials. They're more likely to not trust because they don't see people of their color or their socioeconomic status in the sport. And so there's that barrier too, the trust level, the willingness to try something where there's people don't try. So basically for the recreational level, it's about access and inclusion basically. So if they try
Mhm.
it and like if they even do try it, the other thing is they don't feel maybe included. So their peers might not understand where they came from and might make, um, for example, comments that are not appropriate for, or jokes that may not be appropriate for those kids, and they may not understand that it might hurt someone's feelings and things like that. So, like, feeling included is probably also a big barrier in our sports because we're very homogeneous. And so at the recreation level, I think those are the top barriers. At the elite levels, I think it comes down to inclusion, finances, the athlete's ability to speak out whenever they have experienced any kind of abuses,
Mhm.
and then the understanding of other cultures and art forms and costumes, since there's a subjective component of a sport. So in the elite levels, inclusion matters more because elite skaters in our sport are usually teenagers, and so teenagers for them, their mental health depends heavily on being accepted in their social circles. You need to be mentally tough to do the sport. Like you have only a split second to do a jump and land it. Your mental has to be 100%. And so it can affect the elite athletes as well when they're feeling not included. And especially if they don't have a supportive family structure, which can often happen with the low socioeconomic status
Mhm.
children who go into the sport. And so that's one challenge. The other thing is like I think we're improving this now in the US figure skating, improving this where athletes are now feeling more comfortable speaking up about their any kind of issues, abuses, or health and wellness issues that they
Mhm.
encounter in the sports. Yeah, they speak up kind of after the fact right now, but during the fact, I think the U.S. figure skating and other organizations are working to improve the voice for the athletes
Mhm.
early on and immediately, and so that we can tackle issues as they come up, so to protect their health and well-being before something bad happens.
Okay.
And then I think, and then we talked about understanding other cultures because of the subjective component of the sport as well, and being inclusive in that regard as well.
Okay.
But tackle all of them? Oh my gosh, I don't know. I have so many ideas. It's a very challenging. Yeah, our organization tackles at the recreational level by giving
Mhm.
free ice skating lessons and free equipment because people are more likely to try something out when it's free. And then because we have more some kids coming in that are people of color or low income,
Mhm.
now they bring their friends to it. And now we have like we've had over this year alone, we've had over 200 kids participating in our programs, and over the years we have over 2,500 kids participating in our programs, and we've engaged. And then the other side to figure skating that I didn't bring up as a kind of a barrier is we're not very service oriented. So a lot of us go into the sports. We're so busy focusing on our academics and performing in skating, and we're training so hard. There's very little time for community service, and so and there's no opportunities for community service in our sports. Unfortunately, rarely are there any. So I think that it's this kind of organization. I think we've already engaged over 200 figure skaters, former figure skaters, or current figure skaters or hockey players to also com- perform community service in a sport that they love. And so I think that's another thing that will really help the sports in general blossom, because I think that kind of service oriented thought process
Yeah.
can be contagious and can really help people learn to give back even later on to this to the bigger for the bigger picture as well. So I think creating that culture early on is very helpful, and that's something we've kind of indirectly, I noticed, has been happening through our
Mhm.
organization.
Yeah, that's really great. I want to switch gears a little bit and ask you about your work as a doctor, because I know that this is also connected to what you are bringing back to the sport. I think part of the reason that I had originally reached out to you is because you were doing some presentations about figure skating and injury prevention. And so tell me a little bit about how these two pieces of your life intersect.
Yeah, so I guess, I mean, we all athletes, so we go through our own injuries, and so, but I've always actually I've always wanted to be a doctor. I mean, that's a common South Asian aspiration, career aspiration, I guess. So that was always something. Actually, I wanted to be a doctor before I wanted to be a figure skater, because I didn't even know what figure skating was when I was a kid. But anyway, so when I got injured, it was nice to have another goal to focus
Mhm.
on instead of getting depressed. And so it was nice that I had kind of two careers that I wanted to have. You can see all those, that was all hard work, man. Oh, a lot of blood, sweat, and tears, but it was worth it. I'm so glad I became a physician. So the kind of physician I am, I'm a physical medicine and rehabilitation doctor. Not many people know much about us. Basically, we're a mix between non-operative orthopedics and peripheral neurologist. And so, some of us focus on one area or the other. Some of us do more inpatient and outpatient. So there's a very big gamut of what we practice. I personally focus a lot on musculoskeletal medicine and electrodiagnostic medicine. So I call myself a neuromusculoskeletal doctor. And then I also have this other angle of sports medicine, which we also have on our boards and we're all trained in.
Mhm.
So I do sports medicine as well. And so, of course, the first sport that I wanted to practice sports medicine in was figure skating. And I've been helping out not just recreational, but also higher level athletes, formally or informally. I've been basically the medical director for almost all of the figure skating competitions here in Illinois, and there are many synchro, singles, pairs, everything. And so that's been a fun experience because I basically staff the medical personnel for those events. I have to make sure they understand basic things because not all of them understand the sport. I mean, I've had personnel think that every fall is something they need to act on, like things like that. Like I have to kind of help them understand what to watch out for, how to act, kind of give them basic understanding, what to do when they're on the sidelines, and then how to act quickly and appropriately. And then, of course, I have the medical equipment and everything set up from that angle. And then whenever I need to step in, I fill in whenever I don't have staff. And so I've been basically doing that. It's been fun, very fulfilling. I'm used to living at an ice skating rink anyway, so for me, it's like I feel quite at home there. And sometimes I bring my baby with me, and he sleeps there. So like it's been a fun experience. And I get to kind of see my kind of watch skating, be in touch with the people in the sport, and it's a nice way to be around the sport and basically put two of my lives together, medicine and skating. I've also been invited. I'm one of the physician on the Team USA figure skating roster for physician for coverage to cover international events. So you might see me around there as well. But basically, that's my background. And so when in my clinic, my outpatient clinic, I see chronic injuries and acute injuries. I see the old and the young. I see like obviously sprains and I see arthritis. Like I see all kinds of that. And I do a lot of muscular diagnostic ultrasounds. I use the ultrasound, you know how you look at babies with it. I like to look at joints, tendons on musculoskeletal system with that. And then I do if needed, I do injections as well, everywhere except the spine.
Okay.
And then I do nerve tests where I know it sounds weird, but literally shock people with low voltages to study their nerves. My practice is very heavily reliant on my understanding of anatomy and physiology for just not just the muscles, but also the nerves. That experience has been very helpful because I feel like there's so many things we can improve in the medical side in this sport.
Yeah, no, I think that's really great that you have those intersections and really and directly serving the skating community as a doctor. You spoke a little bit about your own injury and how that impacted you and having to stop skating for a while. What do you take from that experience that you wished you knew then, or that you think about when now as you are working as a doctor?
I was what they call an old soul. So, whenever somebody told me something, I was one of those people who listened to my elders and the mentors. I have family members that were the opposite. They had to kind of experience the problem first before they realized the problem. Basically, one of the things that I learned as an athlete in the medical side is like paying attention to the body was very important for me. So we are very attuned to our bodies. However, there's a culture to ignore those little pains and aches and that come because we want to do well. We don't want to take time off. We're very scared to take time off, actually. And we also don't want to lose sponsorships or whatever else that might come with. We don't want our competitors to know we're injured. Understanding our body is very important because there is, before something becomes bad, you can stop it. You can rehabilitate yourself proactively to prevent something from happening. And so I highly encourage other athletes, listen to your body. If there's an ache and pain, don't blow it off. Don't read too much into it either, but start working on it. And so, for me, I learned quickly because I was fortunate to have met, I don't know if you guys know Kat Arbour. She's a very well-known exercise physiologist. Her mother was also a famous dance. She made dresses for the sport. So anyways, I directly worked with her, luckily in my early years, and she wrote many books and papers, and she was basically living at the rink and she'd help train us. And so I devoured her book very quickly. She was a very important driving force in my understanding of sports medicine. But basically, injury prevention is actually it's actually should be a lifestyle. It's not something you go through temporarily or a phase. It's almost like brushing your teeth every morning. You have to kind of wake up in the morning, what's hurting, and you need to start and you find out what part of the body it is. Like if you can get a doctor or someone who's a athletic trainer kind of tell you what exactly it is. Over time, you start to learn what all these injuries are on your own. You figure it out because you know your body. Working on those parts of the body, stretching them, strengthening them, finding out what does and doesn't hurt, and kind of acting quickly before you're kicked off the ice or you can't do a move anymore or you have to pull out of a competition. So that was one thing, is making it a lifestyle. The other important thing I realized early on is warming up and cooling down is paramount, especially since we're on a usually cold rink. Some rinks colder than others. But the warm up is super important because if you have as we know, if you don't warm up your muscles, they're like rubber bands. They can rip, they can tear. You're more likely to be stiffer and do a jump or spin wrong, incorrectly. So warming up is super important. Cooling down is equally important, actually. You need to stretch to kind of bring blood flow to all those muscles. If you want to have a good day the next day and not be hurting the next day, it's very helpful to cool down and stretch properly. After a very intense routine, your heart rate goes up super high. It's also important to kind of not just stop skating, but to slowly work your way around, do some laps, and then stop skating gradually. And then the other thing that was very important is off ice training. Correctly is important. Unfortunately, a lot of the coaches do off ice training, but not all of them are certified a certain way. So off ice training can be unregulated, and so unfortunately, not all coaches, but some coaches might be doing off ice training, but not understanding anatomy and physiology and the proper mechanics, and understanding when too much is too much or when too little is too little. And so that kind of training and coaches might be helpful, or having other personnel be part of that team might be helpful. But off ice training is super important for figure skating because it's an overuse sport. So we do a lot of practicing. Practicing is paramount to being a successful skater. But in order to practice or do things over and over again, you have to also have the body ready to handle that kind of repetitive moves that you're going to do. And so strength and stretching and accordingly is very important. So that's why off ice training is important. And then being patient with the rehab process when you do get injured was something I learned. You have to listen to what you're supposed to do everything by the book, be patient, don't jump into a conclusion and jump onto the ice or do a certain move if you're not quite, if your body's still hurting. Like pain is a guide. I always tell my patients, use pain as your guide. It is the best guide you'll ever have. If it's hurting, it means you're either doing too much or you're not doing it the right way. And so, and then the final thing I learned a lot is ice is God. I know that sounds like cliche, but anytime I got hurt, anything that felt weird, ice has no side effects. I'm one of few sports doctors that tells my patients to put ice on their injuries too. I mean, yeah, there's medicines and all these other things, but ice is amazing. It is an anti-inflammatory, and if you use it right and you do it the right amount of time and you use it often, it's good for your body and can really help longevity in sports. I didn't take ice baths like LeBron James, But, I did put ice on all of my, anything that hurt, even if I wasn't sure if it was an injury or not, I put ice proactively and used it heavily. And then as I got older, some things I learned about the sport was it was one of the best kinds of exercise ever. To this day, like, I don't have time all the time to go run on the treadmill or go run outside. Yeah, I know I have to go to the rink somewhere, but whenever I went to the rink, it was very, good bang for the buck because it was good bang for the buck because, I'd get my cardiovascular, my strength training, and everything all kind of all in one. I literally to this day, I go and I do my long program with doubles, and obviously I'll warm up properly. I'll do my long pro and doubles, and then maybe work on a few elements, and then for the whole week or two, that's my exercise. Like it works really well. And when I was pregnant, I was fortunate enough to be healthy during my pregnancy, so I was able to go skate. I mean, just simply going around and doing laps, oh my gosh, like, it's amazing, training, and it's better than running because you're not doing impact. There's not a thud with every step you take. And so for a pregnant woman who's comfortable with skating, who is safe enough to go on the ice, I would highly recommend ice skating and doing laps. Like, it's such a great physical activity for even that level at that level. So that's some things I learned about during my time. On that topic though, if I could give one message to the many female athletes that go into our sport, as you know, there's a very big emphasis on weight and body type in the sport, and it affects the judging. It affects your ability to jump and spin. Maybe I have seen female athletes of very different body types succeed doing jumps and spins, and I'm not saying just any jump and spin. I've seen different body types doing triples, and so there is a method to the madness. So you don't have to be the skinny stick to be able to jump and spin. The second thing I would say is that your diet during your teenage years are very important because I have learned personally, but also through the data that's been coming out, what you ate during your teenage years directly affects your ability, whether you get osteoporosis early in life or not. So now your bone health is affected early in life, which if you don't eat properly. The second thing that I've learned is that um, your diet during your teenage years also, not all women want to be moms, but those who do end up becoming moms, the diet during your teenage years really affects your maternal health during carrying child and having children, and also those who want to breastfeed. I know that sounds weird, but there is sometimes, and you don't know that until you actually have the baby. Your milk supply is directly tied to what did you eat as a teenager. And so really, like, if I could tell any athlete anything right now in the sport, it's just since we have a lot of women and a lot of high elite teenage athletes, your diet is so important, and you can still eat a well balanced and a large volume of food and still keep your weight down. There's ways around that. And so that's one thing I really want to share with everybody based on my experience and what I've learned in medicine.
When you tend to see athletes that are in the clinic, do you see mostly like acute injuries that people end up with something from an accident, or do you see more things that develop over time?
Most of the common injuries in figure skating are repetitive injuries. I do see some acute injuries, but most of the acute injuries go to the ER, the urgent care, and clinic, before they come to a clinic like ours. However, when I'm at the sideline covering the figure skating events sideline, I'll see acute injuries. However, I've also seen chronic injuries flare up, or I've seen a skater not necessarily get injured, but I could tell something was not right, and they didn't actually know they were dealing with something insidious. It was crazy. So sometimes you can pick up things if you're watching because of the way they're skating or the way they're favoring something. Like, you can pick up subtle things too, with when you're observing at the sideline as well. And the kind of injuries that we see in figure skating are usually lower body, but I think upper body is underemphasized, especially with the synchro teams and pair skating and ice dancing. There's lifts, of course, but in solo skating, there's a lot of what we call shoulder popping, to get to Bellman's. And so what happens is so the sport draws a lot of hypermobile athletes. Like, that's the ideal figure skater, and the one that's most likely to get the most points is a hypermobile person. And hypermobile is a term that we kind of loosely use to describe people who are more mobile. Their ligaments are more mobile than the general population. And there's like a big spectrum of people fall into that category. But they can be genetic conditions that can be part of the hypermobility syndromes, and there's also people who are just hypermobile. They don't have a genetic issue.
Hmm.
But hypermobile people or athletes tend to pick figure skating as their sport, and they're more likely to get more points, as we know, right? What we're learning more about this population of people is there's actually a lot of pain syndromes and medical conditions that are specific to hypermobile population, and we call it the hypermobility syndrome. I'm hypermobile. I don't have too many problems yet, so but it's something to, in the back of my mind, like I could become a patient that has hypermobility syndrome. Um, and so going back to the shoulder injuries, we'll see a lot of hypermobility with the shoulder. So I just wanted to point that out. The other thing that we see a lot of is back injuries, and I know that's well known about now, especially with I think a lot of pressure with IJS to get more points. Laybacks have become prevalent, not just in the women, but in the men's. And doing all, getting the blade to the head and pulling it overhead and all the other stuff with spirals. And then obviously there's some concussions and head and face injuries, but not as common, maybe, depending on which discipline.
Yeah, it's interesting because I think there's been a lot of attention paid to concussion in figure skating, partly maybe because there's a few dramatic cases and it's something that we see being an issue in other sports. Um, with figure skating, one of the things that I was sort of curious about, we don't wear pads. There aren't too many things that you can do in terms of sort of safety and prevention on the ice. Do you think that there should be any kind of a role for that in terms of wearing pads more, or maybe ice dancers wearing helmets when they learn new lifts or something like that? I was learning recently about how hockey didn't used to have anywhere near as many pads, and it's something that developed over time, and it made me wonder if we're going to look back at skating and think, wow, I can't believe that people were out there practicing without any safety equipment.
Yeah, that's a funny question you bring it up because so I was a skater, right, all my life. So um some of these cultural things are you get used to them, right? So then you don't get the questioning part of it, it takes a little bit of effort because you're like, "Oh, wait. I never would have thought of wearing a helmet competing, right? On juvenile, you know." Um Another thing that's funny about your question is I was I've covered hockey games, and oftentimes in hockey game tournaments we're sitting in the like near the penalty box, and there's usually nothing protecting us from the puck. And there's been multiple times the puck would fly in, and I would luckily, like, we're paying attention. I mean, you have no choice. And you have to duck and protect yourself. And like even the doctors are not wearing helmets, or mouth guards for that matter. And so it's just funny, like where do we draw the line, right? Should
Right.
everybody would be wearing helmets, or like, or is it just a specific population of people that needs to wear helmets? So I think if you can wear a helmet and you're okay with it and you're not worried about, the stigma of going out there and competing with a helmet on, great. But unfortunately, most people are worried about that because aesthetics are part of your costume, and going out there with a helmet on doesn't necessarily look great, according to our current standards, right? Um, but definitely recreational skaters, all first time skaters. I think there's no question. I think all skaters who are beginners in the basic one through, I would say basic 1 through 6 levels should be wearing a helmet, 100%. Now, I think we do a pretty good job. US Figure Skating does a pretty good job. They have
Mhm.
um, definitely put out, nice, great resources on helmets and what kinds to use. And
Mhm.
so those are distributed to all coaches and all programs. I don't know if they're distributing the information. It depends on the rink, I guess. But definitely, US Figure Skating has provided great resources for
Mhm.
um, the coaches and programs to disseminate if they know where to access them.
Yeah.
And there's every sport has different helmets that they need that are sport specific. So you can't wear a horseback riding helmet on ice, and you never shouldn't be wearing ice skating helmet horseback riding. Like there's specific brands that you should be getting. And I actually made a video on this. It's on the City of Chicago website YouTube page, and I kind of try to help disseminate that information to through our programming through the general population here in Illinois, in Chicago, I guess.
Yeah.
Um, but yeah, I think a lot of people don't know about that because I do go to these public skates, especially like these outdoor
Mhm.
rinks where the person walking on the sidewalk wants to go skate, and they
Right.
don't think twice about putting a helmet on, especially kids. And I would say kids and adults equally important to wear a helmet, especially when you first start. As you get more comfortable with the ice, you know, I guess you could be fine without wearing a helmet, especially as you get more comfortable. It's not like head injuries are not that prevalent as you get more comfortable with the
Hmm.
ice and understand how to skate forward and backward, how to stop. When you start jumping and spinning, usually the falls don't go to the head. However, in pair skating, it isn't a bad idea to, I would say, wearing a helmet a little bit longer. When you start pairs, I would say maybe when you're learning new throws and new lifts, especially when you're younger. However, I don't know if people do that. I don't see that around. Yeah,
It's
I don't.
not something I've ever seen, but when I think about this learning pairs and that, I would feel more comfortable if I knew that if my partner goes flying, that she's not gonna, hurt her head when we are learning things and there is a certain amount of uncertainty. And, it's certainly true that like it's when those you see an elite team have a bad accident, it's such a fluke that it's like,
Mhm.
that's the same way that anyone could get hurt at doing a sport. It's not so much,
Right.
not so easy to prevent, but it did get me thinking. I think partly because more people are talking about their experiences with concussions, it certainly seems like there's been more and more of them in ice dance as the lifts have been getting more complex.
Mhm. Ultimately, what I think needs to be done is data needs to be collected, right? On when are these head injuries happening, right? Are they happening when people are learning new skills, or are they happening at the end of their programs? When they're doing difficult skills at the end of their program. So I think if once we can collect some data on when the injuries are happening in the elite athletes or everyone in between, to be honest, then maybe those are the times where we can, there could be a statement made where, we highly recommend that a helmet is worn when you're learning this element. Or when, wearing a helmet in a routine is kind of at this point going to be a long far shot. Because it's also heavy, right? It's another weight on your head. And skaters are doing everything they can. They're unclothing themselves to be lighter right now. So putting a helmet on is another element of like weight and also aesthetics. And so I don't know how. I can't see that happening anytime in the near future. However, at least when we collect data on when these head injuries are happening in routines and competitions, we can figure out what can be done maybe from a length of program standpoint, or requiring elements to be maybe a little bit certain elements to have to be certain like earlier in the program. Um or requiring athletes to train a certain way and have a certain level of endurance that could be measurable before
Mhm.
they are allowed to attempt those kinds of elements in competition. So I think those are all definitely areas of future research for sure.
I really like that you bring up, yeah, the need for the research to be informing this, because that is, I think, the missing step in so many of these conversations. It seems like, especially because figure skating is such a niche sport, that there isn't always that much research that's specific to it. And I remember hearing this around the conversation around whether there should be quad throws in pairs and whether that's too dangerous. And the skaters that were doing the quads were saying, well, no, we learned how to do it in a way that, yes, we had to adjust how we trained so we could do it safely. But, they didn't ask us how many injuries, we were getting. It was a perception that it was too dangerous. And maybe it was in another rink where people weren't training it differently, but like they hadn't gone into the actually analyzing it before trying to make a rule about it. And it seems like that's often, yeah, that's often the case. And we're seeing that same conversation now about backflips and whether backflips are especially dangerous or just dangerous if you do it when you don't know what you're doing. And those are, I've seen both perspectives like forcefully argued.
And I'm of the perspective that there's no limit to what you can do out there, but you have to be trained. You have to have the proper endurance, you have to have the proper strength, you have the right the right alignment and symmetry when you're doing something. And and there's a lot more there's a lot of exercise, there's a lot of science behind all of this. that and a lot of professionals who are skilled at this kind of science, PhDs in exercise physiology and etc., um, who could help guide us in that realm in the sport. For example, just something simple like jumping. Jumping, when you land from a jump, you're a couple times your body weight. You're coming out with a couple times, like a force that's several times your body weight. But kids are at 6-year-old, some of them are doing axles and double cells, but are they necessarily doing off ice training to strengthen themselves to be able to handle that kind of body weight?
Mhm.
If they do that, and if they're strong enough to be able to handle it, then what's wrong with it? But if they're not strong enough to handle it, and then they're going out there and doing all these other things that they're not yet ready, their body's not ready to handle it, I have a problem with that. So I don't think there should be a cutoff, like just a blanket statement on what people can and can't do necessarily.
Right.
But I do think that people have to be, there needs to be some kind of prevention and safety and a regimen that has to be taken care of before they go and start doing those things on
Mhm.
ice. And then what before they even go, there's one thing to do it on the ice, right? And then there's another thing to go and do it in the end of their program, 4-minute program, in Colorado Springs or an altitude, like things like that have to be. There has to be a method to the whole. There
Yeah.
has to be a system in place and more control in that manner. I think, in my opinion. So.
Yeah, and that's a really interesting point that there's a distinction between can you do it versus can you do it in a way that's gonna be safe for you and not lead to injury, and I think that that distinction is rarely made when, especially young skaters are learning new elements. They might get pointed out if it's technique that will make it harder for them to learn more revolutions later, but not necessarily if, um,
Yeah,
not
technique is one part of it, but also having the trained strength to handle.
yeah.
I mean, jumping in the air is not just about leg strength. It's about how well you can pull in, right? So you need arm strength and you need core strength to be able to, not kill your back while for every single landing you're doing, right? So there's all those things have to be done in a scientific fashion, and there needs to be more of those more science behind it that's involved with the athletes before they go and start doing, and there are some training centers that have access to these resources. Like
Mm.
I trained at University of Delaware. We had Dr. Kat Arbour there, and so that's how I understood like there's a science behind all of this when I was young, and I read every single book of hers. That's kind of how I got interested in sports sciences in the first place. I never really told her that until recently. I was like, "Hey, did you know?" She was like, "Really? That's awesome."
Makes sense.
Anyway, so there are, we had access to that at University of Delaware. There are some places that are trying to build that in their facilities. I think US Figure Skating might be working on that. But there are plenty of rinks that don't have access to that. And so, um, maybe working on that would be another direction to go, is having those people on site at the rinks and having them be able to be there, working alongside coaches.
Yeah, for sure. And but I really take that point about the need to be building in that knowledge, not just as part of dealing with an injury or recovery, but that it's so foundational. Like this is ideally information that coaches would either, have more knowledge about or be able to, and also be able to um have experts to go to.
And then the sport, like, obviously is different from other sports in many ways. Like, sometimes the environment is cold, right? So there's, cold temperatures. There's still the chance you'll be at an event and it's freezing, and your body has to be able to adjust for that because the body does change in the cold. And so, emphasizing the warm up and the cool down, very important. It's like mandatory for all athletes to learn that. And I do see a lot of that. However, there are times I'll see people just go out there and I'm like, oh my God, they didn't warm up. Um, the other topic that's very important in our sport and kind of a hot topic is early specialization. In some sports, you can start when you're 15 and go to be a elite athlete, starting late. But in our sport, you almost will not make it to that level unless you start, at the tender ages of like some of us have started at 4, 5, 6. The data is again lacking. We need a lot of research in this area. Whatever I have seen out there talks a lot about how pre-adolescent people should start skating when they're pre-adolescent to prevent injuries and reduce burnout, prevent long-term overuse injuries, increase longevity in the sport. Um, there's so many reasons to that are highlighted to in terms of what the data shows and with starting too early for any sport. Um, but being starting at pre-adolescence for figure skating is almost like a I mean, most people don't do that. I started when I was 9.
Yeah.
Um, but I can't you can't just go off of me. I'm just an N of 1. I still skate. I mean, I've had 3 kids. I still skate. I can still do all my double
Hmm.
jumps. I did have one major injury maybe, but I haven't broken any bones. I don't know. I can't go off of me, but I can just say that I think there needs to be more data on that and collected on people who start early, people who start later, and where is that sweet spot of when to start? And if you do start early, what needs to be done to do you need to have access to equal amounts of free play, when you're playing board? There's actually some data on this already, just general data that,
Hmm.
you should the rule of thumb with general blanket statement from the American Medical Society for Sports Medicine is children should be playing organized sports for approximately the number of hours a week for what their age is. So a 3-year-old can do 3 hours of organized sports a week, or recommended to do 3 hours of organized sports a week. A 6-year-old can go up to six. But what data has shown is free play is very important, especially for children, and so maybe balancing that more, especially if you do wanna start a sport earlier, making sure you do a little and then finding ways to enhance your skills and your, strength, your body strength
Hmm.
and coordination through other sports, it can still translate, and understanding that, can be very helpful, I think, for, anyone who wants to go into figure skating, start early, put their kids in early, um, while we're still working on the data, so.
Yeah, it'd be really interesting to understand, at what point is more, is more always more when it comes to training and, more repetitions of an element, more hours on the ice. Like I think there's sometimes an assumption that like you should do as much as you can possibly like afford and your body can stand and that will always be better. And that's I would guess that that is probably not true, but like where that edge is for individuals and at different age levels is something that would be interesting to understand as well as the benefits of both physical and mental of having a diversity of things that you do.
And then other things like you talked about red S earlier before we started talking. Yeah, it's a fairly new term. It's been around for about 10 years, but we're now hearing about it because we used to call it female athlete triad, but we're
Hmm.
starting to understand it's not just the females, it's the males. And as you know, there's not just a female and male gender. But anyway, it's more inclusive of all genders, the term. And it's also not, it accounts for the term is just more inclusive of the gender thing, and it's also more, understanding of that it may not necessarily be an eating disorder, causing it or so it's a little bit more of a general term, and then there's obviously different causes of it and different ways to treat it. It can be challenging and but basically RED-S stands for relative energy deficiency syndrome, and we see a lot of it in figure skaters. We'll see a lot of it in gymnasts. A lot of the sports where body image is important. Is where we might see it more of. And then the other thing to think about in and what I my solution for the red S thing is starting early in terms of educating families and children and coaches too about this is possible. It's high likelihood that this child, if they continue the sport, it may fall into this category and have this syndrome. So what can we do to educate everyone now before this syndrome hits someone, right? So like prevention is education and prevention go hand in hand together. And so if we can figure out a way to, just like red S, but there's other common conditions and, just even musculoskeletal injuries that are common, educating people early before, like when they're just starting is I think key. Figure skaters just generally, and I can speak for myself as well, but there's a little bit we're scared to take time off. And so, that can be a problem because we may be dealing with something, but may not wanna talk about it or tell anyone about it because we don't wanna be told, "Oh, you just need to take time off." And now taking time off is not necessarily the solution to everything. You can always work on something, you know? One of the things I did when I was injured sometimes, is I would go to the rink anyway and just watch the other skaters practice. And even watching is a form of practicing. Obviously you want to watch the people who are good. So you like watch the good habits, but visualizing and watching is actually your body is training itself when you're just going there. And so taking time off doesn't necessarily mean you go sit at home, sit on the couch and watch TV,
Hmm.
or just lie in bed and just be, sad about your day, right? But taking time off could mean you could work on your other part of your body. You could go to the rink and watch your colleagues. You can go watch a competition. Like there's other ways to take time off.
Hmm.
And so and but we need to also normalize that it's okay to speak up about your injuries. It's okay to talk to your coach about them, and the coach has to have that dynamic with their athlete in the first place, right? And seeing the doctor and following up with the doctor, that's important, and it should be emphasized as well, because a lot of people will come or they won't follow up, or they are afraid to even see us in the first place because they think we're going to just say, hey, you got to take time off. And some of us do. Some of us doctors are, we do say that you do got to take time off. Some of us are more cautious than others. Every sports
Right.
doctor is different. So some of us are more comfortable with the injury. Some of us are more comfortable with trusting the athlete, because each athlete's different, right? Some of them, we feel like they're not going to follow our instructions. And some of the athletes we meet, we feel like they're going to do everything to a T, so we're not as worried about them. So it depends on our trust in the athlete. It depends on our comfort level. It also depends on our philosophy. And then the big topic about like sport doping and abuse, which is way beyond what we're talking about now, but is happens in our sport, as we know, not just in the women, but also in the men, and it could be anything. And substance use is socially very prevalent in our sport, as is in other sports and in the general population. And so, all those things like even caffeine and mixing it with things and energy drinks and all that. I'm actually probably going to give a talk on this at the next
Yeah.
American College Sports Medicine meeting next year. That's my goal, is to talk about this next. But
Yeah.
those are some things to also keep in mind in terms of health issues that come up with our athletes, because I think the philosophy of what do I need to do to get results right now, and not looking at the long term and understanding the implications of your choices now, can really leads to these kinds of behaviors. It's a cultural thing too, and it's not just necessarily figure skaters, but it's like all over, the country. Sometimes, go to college and things like that. You'll see it around a lot, and so I think also starting early, educating kids and families about like how sometimes doing something the long way is the right way to do it, and is a better solution in longevity from a longevity point of view, and helping emphasize delayed gratification, and learning that winning at all costs is not a healthy mentality to take um, all the time. And so those are some of the other things I think about when I want to improve things in a sport.
Yeah, it's interesting just how much really goes back to, those questions of the early specialization and the idea that anyone who might take a little longer to learn something, maybe because they're starting older, and I don't know how true it is that you have maybe more difficulty with motor skill acquisition as you get older, that sometimes things take longer to learn. Often that skater, even if they could eventually get to be to a high level, I think often we don't even know, because people would have been discouraged them from starting if they weren't, great right off the bat. These things definitely feel like they tie together in terms of um, what opportunities there are to even learn and have the data
Yeah.
when so many factors funnel people down the same path.
I started late, and I was just doing it because I liked it, and
Mhm.
we didn't know anything about ice sports. We came from a South Asian family, which, like we talked about with the previous talk, that wasn't a common thing to go into. And
Right.
even athletics in general isn't a common thing for South Asians to go into. And so, anyway, I went into it because I liked it. I learned quickly, in my early preteens, I guess, right? Nine was preteenish. And then kind of improved really quickly in a short time. And then, I mean, I was winning regionals in 3 years. And Like, so my body was ready, so I was able to handle that. And I'm not saying everyone should do it this way. I'm just talking about myself.
Yeah.
But then I went through a period in my teenage years where I was like not able to figure anything out. I was just all over the place. Like I mean, it took me, I would say double axle, like took me freaking forever to learn. And I just couldn't get it. I just couldn't get it. And that's kind of when I started falling behind and I started to like lose self-confidence. And I was like,
Mhm.
I like skating, but I can't keep up. And it's not like somebody's going to stay in the sport when you keep losing. Like your parents are going to be like, hey, like, why don't you focus on something you're actually good at? Like things like that come up and you're like, okay, how much money you're going to keep investing in this, right? And how much time we're going to put in. Because it's not like skating is a once a week practice
Yeah.
schedule. You're practicing 3 to 4 hours a day, 5 to 6 days a week. And then, plus more, off ice and dance classes and everything. So you put a lot into it. So you also want to get something out of the whole thing when you go through all of that. Anyway, long story short, I was like a noodle. I couldn't figure it. I was doing all kinds of off ice training work. I just couldn't get this jump. And then I think what happened was I did get it. It wasn't the best. It was still very inconsistent. I competed at Worlds. Then I got injured.
Hmm.
Probably because I know probably maybe there's some genetics involved, and probably because maybe like a lot of I was a hard worker, right? So beating my body up, and
Hmm.
I would go like hours falling, falling, falling. Anyway, long story short, then I had to quit, and I didn't want to quit, but when you have an injury, it's like a sudden, like it's there's a slow process of letting go, and then there's the sudden like, oh my God, I can't do anything anymore, and you're being told that, you have to stop, and so then, um, that that itself is like an identity crisis in itself because a lot of us who go into the sport end up holding our identity in the sport, and then that when you're like, "Oh, now what am I? What am I? I'm not a figure skater anymore. What am I?" And so that's a whole mental health thing in itself. And then, but luckily I had other things I wanted to do in my life and I was able to focus on them. And when this injury happened and I was able to go in that direction, and then I ended up going back into the sport and really start skating every day again until I was like, I think 21 or 22. So now I'm considered now an old adult skater. But the craziest thing, I couldn't do a Bielman the same way anymore. My Bielmans are way better when I was 15
Hmm.
because my back was out, but I was just learning my triple jumps way better. And I like the way I was able to figure my body out was so much. So there was I was more attuned to my body at
Yeah.
that time. And I was actually doing better, performing better in my later years. Um, and so I thought that was an interesting experience because most people stop skating when they're 17 or 18. So they don't actually know what potentially could be capable of because we
Yeah.
have that, we have to go to college, we've got to get a degree, we got to have a job. Like most of us have to stop at that time. And
Right.
there is a way to keep going. It's just, it's a little bit of hard work. My coach would always tell me, you're like a single mom. You're juggling, like medical school academics. You're juggling skating. I was paying for my skating. Like I was paying all my bills. My mom and dad were like, we're not, you're 20, you're in your 20s. I mean, it's all you at this point. I
Yeah.
mean, we took care of your academics, your education. We paid for your skating up until now, but you want to do this, you're on your own. So I was working 3 jobs. I was, handling a courses at school. It was a lot of work. But I
Hmm.
was passionate about what I was doing, and that's how I was able to I didn't have to. You have to also understand that like you can't be perfect. You can't have a 4 hour a day training schedule anymore. So you have to really, when you're going, make the most use of your time, be smart, and then you have to be very time efficient. And so things like that, I learned a lot of that later. But what was the biggest thing was that even though I was older or considered aged out, I was actually more attuned to my body at that time. So
Wow. Yeah, that's really interesting, and it's something that I've noticed is that like for kids, especially if you're when things do start out coming easily, you don't
hmm
necessarily learn until later the
hmm
how to actually analyze and understand your own body and how to work with it. Yeah, that's really interesting, and it does it does ask that question of how many people, if they had the opportunity to go back and try to train even after after taking some time off. I mean, both in terms of like allowing injuries to heal and also potentially being able to try with a body that gave them that opportunity. We've seen it a few times, but
Yeah, Alyssa Liu is the perfect example. I
yeah,
mean, that's she's the classic
yeah,
example of someone who had to take time off and come back. And she's so comfortable with herself because she had that time to process her everything, just her body, her mind, everything. Mental is so important. So if you're working nonstop every day, going to school, skating every day,
Mhm.
where is that time to reflect and process things, right? And if you're doing that for so many years, your mind just shuts off. And then at some point burnout starts to kick in. And so making sure you have that time for your mind to catch up to what all the hard work you're doing physically is very crucial. And sometimes people need to take time off to get to that point. And so that's something I thought was interesting. The other thing I wanted to also touch, sorry, lots of things to talk about.
No, no,
Um,
oh, great.
a lot of other athletes in a lot of sports, they're more connected with their universities or their high schools, and so a lot of these athletes get pre-participation physicals before they are allowed to participate in their sport. Figure skaters, we're not plugged in. So what happens is we may go into the sport at young ages even, right, and be in it working hard. We're harder than some of these other, like, I'm not saying other athletes don't work as hard as us, but we have to put in a lot of hours. We're up there, compared to some other sports, and we're all year round. So, um, uh, we pre-participation physicals are so important for us. However, there's no real system in place for that.
Mm.
And if we do want it, we have to go to a specialized center that offers them and pay money for it. Which isn't necessarily I think I was talking to one of the local physical therapists who they're private practice and they have a lot of figure skaters come through,
Mhm.
and they like charge like $200 and you can get a pre-concussion assessment, so you can get an assessment of your cognitive status and your function, but before
Mhm.
getting a concussion, so you know what your baseline is.
Yeah.
And then if you do have a concussion and you go see them again, you can kind of see, okay, what happened and did it affect me, right? But they also do the whole thing. Like they screen not just your brain, but also like your heart, because a lot
Mhm.
of there's a lot of cardiac, some athletes are dying at young ages
Yeah.
because have they have genetic cardiac problems that were silent for so many years. As we know, Sergei Grinkov
Mhm.
was one of those cases. But there's also even today, like I bump into these like young teens who have heart problems,
Mm.
and they didn't know about it for so many years because they never got screened for these.
Yeah.
And a lot of these other sports, they have screening in place already for this. And so, not just like the motor part of it, but also the cardiovascular and the cognitive and yeah. So anyway, I think that's a future direction to improve on as well from the sports medicine standpoint.
Yeah, that makes so much sense. Before we wrap up, I want to circle back to just one specific thing that you had mentioned earlier, about the hypermobility and flexibility and Bielmans and all of that. And I was curious if you had any advice about training that kind of, in more extreme flexibility in a safe way.
So the first thing is awareness that you have hypermobility. I think nobody even knows the term. And
Mm.
oftentimes, like these kids grow up, they're 25, dealing with some kind of issue that falls into the hypermobility syndromes. And they get diagnosed like it takes forever for a healthcare provider to realize it or diagnose them just because it's not a very commonly known about condition. Hopefully in
Mhm.
5 years I'll change. But anyway, so knowing about it is I think important. And then so again, in a decentralized system, how to centralize that process, that's a challenge that we had to take on. And then once they're aware of it, the you always want to balance. Basically, the rule of thumb, and this is very simplified, is you want to balance your flexibility with strength. So you don't want to just be able to get your arm behind your head and be able to pop it through. You also want to make sure you're strengthening your rotator cuff muscles. Because your ligaments are really lax and loose. Ligaments are basically the structure that connects bone to bone. And you can't really like strengthen them necessarily, but the muscles around the ligaments, they're there too, and tendons, which connect bone to muscle, can be strengthened and they can help provide stability when you have risk factors for instability. So I'm using a shoulder as an example, but if you strengthen your rotator cuff and keep giving blood flow by using it, right? And continue to build it up, you're helping to offset the over and a repetitive nature of and popping your shoulder through. The other thing needs to be done is I know we talk about jump counts, right? People should monitor how many jumps they should be doing per session. What
Mhm.
actual number that is, we're not exactly sure. There needs to be more research. However, listening to your body and not going from and always going in a gradual fashion. This is just a rule of thumb in all sports, but don't go from doing 10 jumps a day to doing 50 jumps a day the next week. You want to gradually progress, and also listening to your body, very important. We don't really do a good job about in figure skating. We have an ache and a pain, and we think that we fall all the time. So we get aches and pains all the time. So pain for us is normal. And so we've normalized pain so much that when we actually have an injury kind of creeping in, we don't actually notice it. We don't actually pay attention to it. And so listening to the body, because that's your clue that something needs to be worked on. And if you catch that early, you can prevent something bigger, major, surgical later on in life. So, or later on the next week, even. So, that is something that is super important, is paying attention to your body, and then doing only so many Bielmans per session, only so many laid back spins per, like counting those and keeping track of them, and then seeing how your body responded the next day. And maybe even keeping a diary on it, like if you have to. Like I know a lot of us, I took a lot of notes when I learned from my coaches. I had all kinds of notes. I have books and books of notes from my coaches, but I didn't really keep a diary like my mental health or like how my body was feeling. Like if you have a minute to write down, okay, when I did 20 jumps a day for a week, I was starting to notice some weird ache in my shoulder, my back or my legs, or when I did like 100 Bielmans, within a 3-day period, I noticed this weird ache and pain in my shoulder. Is it going to go away? You ice it, you keep track of it, you careful with it, see if it goes away. If it doesn't go away, then you're like, okay, that was maybe too many. Until we have the data, right? We don't have data and everybody's different, but until we have data, you have to listen to your body. Your body is your data.
I always like to wrap up with the broad question, because we've covered so many different things. What do you hope for from the future of figure skating?
I would hope for more balance, not just having great avenues for the elite skaters, but also for the recreational skaters. And I think US figure skating looks like they're doing a lot in that regard. For example, like there's now collegiate competitions now, and there's more different choices for younger recreational skaters to choose what paths they want that work for them. And people who necessarily don't have the ability or the interest in training 5 days a week, but they still want to be participate in the sport. I think those are all improving. So US Figure Skating is doing a great job there to kind of make the sport more accessible and more inclusive to all people from a activities and a competition standpoint. So we could do more of that. And then the other thing I would like for is just, we talked about this a lot, but a centralized educational process to help before things happen. Um, Not just from a medical standpoint, but even a psychological standpoint, or just just general, like there should be some kind of baseline information that all athletes should have access to, whether they're just starting at 6 or they're been in the sport for so many years. So I think that would be very helpful. And then I guess having more allied healthcare professionals at the skating rinks would be awesome, at these big training centers. I know they're also working on that too, but having more access to other professionals like physical therapists and athletic trainers and uh, exercise physiologists as well. That could be a really good interdisciplinary approach to the athletes, and they have all the knowledge they need to be successful and healthy at the same time.
Thank you so much. This has been such a fun conversation with many pieces and lots of great information. So I really appreciate all of your time.
Thank you so much.
Thanks again to Ami. You can find the transcript and links to the things we talked about in the show notes and description. You can reach me with comments or suggestions by email at fsfuturepodcast@gmail.com or Instagram at futurefspodcast. You can support my work with a one-time or monthly donation at ko-fi.com. That is ko-fi.com/futurefigureskating. Remember to subscribe to the Future of Figure Skating on YouTube or wherever you subscribe to podcasts and share it with your friends.